Today, we're diving into something pretty scary. How just getting sick can now lead you straight into financial ruin. And it all starts with stories that are becoming way too common.
No, you did not read that wrong. A 2,500% increase. That's the reality for a father in Orlando who has diabetes. He's now facing this totally impossible choice, between managing his health and keeping his family financially afloat. And trust me, he is far from alone in this.
So, what on earth happened? How did we get here? How do we get to a place where just staying healthy comes with a price tag that can literally bankrupt you? Well, this wasn't some random accident or market trend. It's the result of something much, much more specific.
What we're witnessing right now is a perfect storm. It's what happens when two huge separate policy shocks crash into each other at the exact same time. And together, they've turned our healthcare system into a kind of financial weapon aimed right at everyday people. So let's break down exactly how this happened.
Okay, so this whole crisis really boils down to a two-part shock. First, a sudden, massive price hike for your insurance. And second, the government took away a critical financial shield that used to protect people from medical debt.
All right, first up, the premium shock. So, for the last few years, special subsidies made sure that nobody paid more than 8.5% of their income on health insurance. Pretty straightforward, made things affordable. But those are expiring, and that means the return of something called the subsidy cliff. It's exactly what it sounds like. If you earn just one single dollar over the income limit, poof, all your financial help vanishes and you get hit with the full, jaw-dropping cost of your premium.
Now, check this out, because this chart really cuts through the noise. You might hear folks blaming this on inflation or greedy insurance companies, but look at the numbers. The base rates insurers are charging, they're going up, about 26%. But the cost that you, the consumer, have to pay, it's exploding by 114%. That huge gap, that's not inflation. That's the direct result of pulling away financial aid. This is a crisis created by policy.
And here's the second blow, the credit trap. There was a federal rule that was just finalized, a really big deal, that banned most medical debt from ever showing up on credit reports. It protected about 15 million Americans, but that protection is gone now. A federal court, following a legal challenge, struck the rule down. And just like that, unpaid medical bills are back in the game, ready to be weaponized and reported to credit agencies all across the country.
So you put those two things together, more people who can't afford insurance, and a system that's now allowed to punish them financially if they get sick and can't pay, well, what you get is this devastating cascade of harm.
Let's just walk through this, because it's basically a pipeline that takes people from a doctor's office straight to poverty. Step 1. The premium spike hits, and millions either lose or just can't afford insurance anymore. Step 2. Life happens. An illness, an accident, and suddenly there's this mountain of medical debt. Step 3. Thanks to the new rules, that debt gets sent to the credit agencies and your credit score tanks. And finally, Step 4. That wrecked credit score leads to financial exclusion. Suddenly, you can't get a mortgage, a car loan. You might not even be able to rent a new apartment.
And believe me, this isn't just some theory. This is happening to real people. Look at this. A 63-year-old in Atlanta goes from paying about $200 a month to over $1,200. Same story in Boise, a 466% jump. And that family from Florida we started with, a mind-boggling 2,518% increase. These aren't just numbers. These are lives getting turned upside down.
And when you add up all these individual stories, what do you get? Almost 5 million people. 4.8 million Americans are on track to lose their health insurance next year alone. That's millions of people who are about to be completely exposed to the catastrophic costs of getting sick in America. And for anyone who does get sick and can't pay that bill, the punishment is swift. The second that medical debt lands on a credit report, a person's score can plummet by an average of 20 points. So what does a 20-point drop actually mean in the real world? What means this? It means you could pay an extra $20,000 in interest over the life of a typical mortgage. It's the difference between getting a loan to buy a home or start a business or being told no. This isn't just a health crisis anymore. It's a policy choice that's actively blocking people's access to a stable, middle-class life.
And this damage doesn't just stop with individuals and their families. Oh no, it sends shockwaves through the entire system, putting immense strain on our economy and our healthcare infrastructure.
And this pain isn't spread around evenly. As you can see here, even before this new crisis, the majority of Black and Hispanic adults were already struggling with medical debt.
These new policy shocks are basically pouring gasoline on the already raging fire of health and financial inequality. The people who are most at risk here are the ones who can least afford another hit. We're talking about older Americans who are trying to get to retirement, entrepreneurs, freelancers, gig workers, anyone with an income that isn't always stable. For them, this isn't just about healthcare anymore. It's about their entire livelihood. And the damage just keeps spreading. Think about it. When millions of families suddenly have to find thousands of extra dollars just for health insurance, they stop spending money elsewhere. They stop going out to eat, buying cars, fixing the house. That massive drop in spending is projected to cost the U.S. economy almost 340,000 jobs.
And what about our hospitals, especially the local and rural ones? Well, they're bracing for a $7.7 billion tidal wave of what's called uncompensated care. That's just a fancy term for all the medical care they have to provide by law, but for which they will never, ever get paid. This is the kind of thing that pushes community health centers and rural hospitals to the absolute brink.
So, is this it? Is the damage done? Is this just our new reality? Well, not necessarily. The same research that laid out this entire problem also points to some pretty clear ways to fix it.
The proposals are actually pretty direct, and they target the two shocks we talked about. First, to fix the premium shock, make those enhanced subsidies permanent. Second, change the law to get medical debt off credit reports for good. And beyond that, bring back protections for people with unpredictable incomes and give more support to those safety net hospitals that are taking the biggest hit.
And this really brings us to the core of the issue. This isn't just about policy debates or budget numbers. It's about a fundamental value. Getting sick is a part of being human. It is not a character flaw. It's not a financial crime.
When you create a system that actively punishes people for getting sick, well, that's not just bad economics. It's something darker. It's the normalization of cruelty. It's a deliberate policy choice to inflict financial pain on people for the simple act of needing a doctor.
And that really leaves us with one final question to think about. In a country like ours with all its resources, should a medical diagnosis ever, under any circumstances, be allowed to become a financial death sentence?